If you've ever leaked a little when you sneeze, laugh, or jump, and quietly hoped nobody noticed, this video is for you. And if you've noticed changes in your intimate confidence since childbirth or with age, and assumed that's just something you have to accept, I would like to respectfully disagree with that assumption. I want to start by saying something super important. The concerns I'm going to talk about to you today are some of the most common things women bring to us at Premier for Her. And they are also, almost without exception, the things women have been carrying quietly for the longest time before they finally spoke to someone about them. Urinary leakage when you laugh, sneeze, cough, or exercise. Vaginal dryness and discomfort. A feeling of looseness or reduced sensation after childbirth, reduced intimate confidence as you move through different stages of life. These are not small things. They affect how women feel in their bodies every single day. They affect relationships. They affect whether someone feels comfortable exercising, laughing freely, or even just being intimate with their partner. And yet, most women spend years not saying a word about any of it because nobody told them there's a conversation to have, let alone a treatment that can address it without surgery, without stitches, without any significant downtime.
Yep.
That treatment is Thuzzle by GMV. And that's what this video is about. I'm going to cover everything, what it is, how it works, who it helps, what a session actually feels like, what results look like, and the questions you should ask if you decide to explore this further. By the end of this, you'll have everything you need to decide whether this is something worth looking into for yourself. Before I explain what Thuzzle does, I want to explain why these changes happen in the first place. Because understanding the cause is what makes the treatment make sense. The vaginal tissue, the pelvic floor muscles, and the surrounding structures are all collagen-rich tissues. Collagen is what gives the tissue its firmness, its elasticity, and its structural integrity. Two things cause significant collagen loss in this particular area. The first is childbirth. Vaginal delivery stretches and stresses the tissues of the pelvic floor significantly. The body recovers, but the collagen and structural integrity that was there before doesn't always fully return, especially after multiple deliveries or a particularly difficult birth. The second is hormonal change. As estrogen levels decline during perimenopause and menopause, the vaginal tissue thins, dries, and loses elasticity. The pelvic floor also weakens. This is why many women notice a cluster of changes in their 40s, 50s that they didn't really have before. Dryness, discomfort, leaking when they laugh or jump, reduced sensation, reduced intimate confidence. These are all the symptoms. These are not signs that something has gone wrong with your body. They are natural consequences of tissue changes that happen to almost every woman at some point in her life. The question is whether you want to do something about them. Thuzzle addresses the underlying tissue change, not just the symptom. Thuzzle is a non-invasive radiofrequency treatment developed by GMV, a medical device company with a strong track record in women's intimate health and technology. Radiofrequency energy, or RF energy, is a well-established medical technology that has been used in aesthetics and medicine for decades. You may have heard of it in the context of skin tightening, for the face, or for the body. The principle is exactly the same in Thuzzle, but applied specifically to the vaginal tissue and the pelvic floor. RF energy generates controlled heat deep within the tissue at a precise depth. This controlled thermal stimulation does two things. First, it causes existing collagen fibers to contract and tighten immediately. This is what produces the immediate sensation of firmness and tightening that many patients notice right after the first session. Second, it triggers the body's own wound healing response, which stimulates the production of new collagen and new elastin over the next few weeks or months following the treatment. This is what produces the longer-term improvement in tissue quality, moisture, structural integrity. The treatment also addresses pelvic floor, specifically, which is why it's effective for stress urinary incontinence. You know, the leaking that happens when the pelvic floor isn't strong enough to resist sudden pressure changes from sneezing, laughing, jumping, or even exercise. Thuzzle is delivered using a specially designed applicator. It's not a laser, doesn't break the skin surface, there is no cutting, no stitching, and no recovery period required. Let me go through each of the two main things Thuzzle addresses in detail, because they're quite different concerns even though they often come together. The first is vaginal rejuvenation. This covers the range of changes women notice in the vaginal tissue itself, sometimes dryness and reduced natural lubrication, loss of firmness and elasticity, reduced sensation during intimacy, a feeling of looseness, particularly after childbirth, discomfort during intimate contact. These concerns don't always come together, and they don't always arrive at the same time. Some women experience dryness primarily. Some noticed reduced sensation. Some are bothered by the looseness after delivery. Some notice all of these gradually as they move through perimenopause. Thuzzle addresses all these symptoms through the same mechanism, stimulating collagen and elastin in the vaginal tissue so that it becomes firmer, more elastic, better hydrated from within, and more sensitive. The second concern is stress urinary incontinence. Stress urinary incontinence is the involuntary leaking of urine that occurs when sudden pressure is placed on the bladder. Sneezing, coughing, laughing, jumping, running, even picking up something heavy. Any sudden increase in abdominal pressure that the weakened pelvic floor can't resist. It affects a significant proportion of women, particularly those who have given birth, and it's one of the most underreported concerns in women's health because most women feel too embarrassed to mention it to their doctor. If you've ever crossed your legs before you sneeze, avoided a trampoline with your children, or wore a panty liner, just in case during exercise, this is exactly what I'm talking about. Thuzzle strengthens the pelvic floor tissue through RF stimulation, improving structural support around the bladder and urethra so that the resistance to those sudden pressure changes improves over a course of treatment. Women dealing with these concerns have historically had limited options. For urinary incontinence, the traditional medical route has always been pelvic floor physiotherapy, which works well but requires consistent effort over a long period of time, or surgical options like a mid-urethral sling procedure, which carries all the considerations that come with any surgery. For vaginal rejuvenation, topical estrogen creams and hormonal replacement therapy addresses the dryness to some degree, but they don't address laxity or structural changes. Thuzzle sits in a completely different category from all of these. Non-invasive, no surgery, no stitches, no anesthesia, no recovery period. You can come in for your session and go about your day immediately after. No hormones. Thuzzle works through the body's own collagen response, not through external hormonal supplementation. This makes it an excellent option for those women who cannot use or don't want to use hormone-based treatments. Comfortable, the treatment is designed to be very, very comfortable throughout. Most women describe a warm sensation during the session. There is no significant pain, no numbing required for most patients. It's super quick. A session typically takes between 20 to 40 minutes depending on the areas being treated. It fits into your lunch break. There are progressive results. Because Thuzzle stimulates new collagen production, the results improve over time rather than peaking immediately after the treatment. Most women continue to notice improvement for 3 to 6 months after their treatment. Now, the results are super long-lasting. With appropriate maintenance sessions, results can be sustained for a significant period of time. It is private and discreet. Every Thuzzle session at Premier for Her is conducted in a completely private environment by a female doctor. Everything you share and everything that happens in the room stays in the room. Thuzzle is appropriate for a wide range of women, but let me be specific about who tends to benefit the most. Postpartum women who have noticed changes in vaginal firmness, sensation, or pelvic floor strength after one or more vaginal deliveries. These changes can occur even after straightforward birth and often don't fully resolve on their own. Women in perimenopause or menopause who are experiencing vaginal dryness, thinning of the tissue, or discomfort during intimacy as a result of declining estrogen levels. This can benefit them too. Women of any age who experiences stress urinary incontinence, the leaking I described earlier, whether it's been a few months or even several years. Women who want to be proactive about maintaining pelvic floor strength and vaginal tissue health before more significant changes occur in the body. Thuzzle can be used as a preventive and also a maintenance treatment, not just a corrective one. Women who cannot use or prefer not to use hormone-based treatments for any reason, this is a very, very good option as well. Who is Thuzzle not appropriate for? That's a question we should also be asking. Women who are currently pregnant. Women with active vaginal infections or inflammation at the current time of treatment. These need to be resolved first. Women with certain medical devices or conditions that contraindicate radiofrequency treatments. This is assessed during the consultation. This is exactly why consultation before any treatment matters. Not to convince you to proceed, but just to make sure that the treatment is actually right for you before we even do anything. Let me walk you through exactly what a Thuzzle session at Premier for Her looks like, because I find that knowing what to expect beforehand makes a significant difference to how comfortable patients feel going in. You start with a private consultation. We will talk about your concerns, your medical history, your previous pregnancies, the deliveries if relevant, and what you're hoping to achieve after the session. We answer every question you have, however basic or however specific. There are no judgments in this room and no question that is off limits. If Thuzzle is right for you, we can schedule your first session almost immediately. Most women begin with a course of 3 sessions spaced 2 to 4 weeks apart, although this is tailored based on your specific concerns and how your tissue responds. On the day of the session, you will lie down comfortably in the treatment room. The Thuzzle applicator is gently introduced. The RF energy is delivered in controlled cycles to the vaginal tissue and the pelvic floor area. Most women describe the sensation as a warm, very gentle heat. Some notice a mild tingling sensation, but the treatment is designed to be super comfortable throughout. And if at any point the sensation feels too intense, the settings are adjusted immediately. A typical session takes between 20 to 40 minutes, and after the session, you usually can dress up and leave immediately. There is no physical sign that you've had anything done, no redness visible, no discharge, no discomfort that would prevent normal activity. We advise avoiding sexual activity for at least 48 to 72 hours after each session to allow the tissues to heal and settle appropriately. That's it, your day continues normally. This is the part of the conversation I find most important to set expectations around properly. Because Thuzzle works progressively and I want every patient to understand what that means before they start. Immediately after the first session, some women notice a mild sensation of tightening. The collagen fibers that were already there will contract slightly in response to the RF heat. This is real, but very, very subtle. Over the next 2 to 4 weeks following the first session, the collagen stimulation process starts to form. The body starts producing new collagen in the treated tissue. This is the process that produces the meaningful changes in firmness, moisture, and sensation. Most women begin noticing clearer changes after usually the second to third session. Improved lubrication, a firmer sensation, reduced leakage episodes, better sensation during intimacy, and all with no downtime. The most significant results typically appear between 3 to 6 months after completing the full course of sessions. This is when new collagen has had time to mature and has fully integrated between the tissues. For urinary incontinence specifically, most women report a meaningful reduction in leakage episodes over the course of treatment. Some achieve complete resolution. For some, the improvement is significant but not total, and maintenance sessions usually help sustain and build on it. For vaginal rejuvenation, the improvement in dryness, firmness, and sensation follows a similar progressive timeline. Maintenance sessions are recommended approximately every 6 to 12 months after the initial course, just to sustain the collagen response and the results it produces. I would like to address something directly because I hear a vision of this in almost every consultation for intimate health treatments. I thought I just had to live with it. Or I assumed it was normal, so I never had to mention it. Or I didn't think there was anything a doctor could do without surgery, and I really don't want surgery. All of these are understandable. The conversation around women's intimate health has been significantly underserved for a very, very long time. It's not openly talked about, and it's rarely covered in the kind of health content women have easy access to. And so women arrive at their 40s or 50s having quietly managed all these concerns for so many years, and they didn't even know that there was a non-surgical clinical solution. Here is what I would like you to know. Pelvic floor health and vaginal tissue health are not separate from your overall well-being. They are a part of it. The way you feel in your body during daily life, during exercise, intimacy, is connected to the health of this tissue. Waiting doesn't make it better. The collagen and tissue changes that drive these concerns are progressive. They do not reverse on their own, so addressing them earlier when the changes are less advanced generally produces faster and more complete results. And choosing to address them is not vanity. It is not self-indulgence. It is a completely legitimate healthcare decision that affects your quality of life every single day. You owe yourself the same care and attention you give everything and everyone else. I want to say something about the environment in which you'd have this treatment, because I know for many women, the barrier to even having this conversation is not really the treatment itself. It's more of not knowing whether the clinic will feel safe, is it discreet, are they genuinely supportive for me? Now, Premier for Her was created specifically for this reason. Every consultation, every treatment happens in a completely private room. Every doctor on the Premier for Her team is experienced in women's intimate health and approaches every conversation with the same professionalism and genuine care. You will not be rushed, I promise you. You will not be judged. You will not be made to feel like your concern is too small or too embarrassing to mention or discuss. You can ask anything. We have heard every single version of this question, so no judgments and nothing surprises us. Everything you share is confidential. And if after the consultation you decide Thuzzle isn't the right thing for me, or the timing isn't right, that's completely fine. A consultation is information, not a commitment. We are here whenever you are ready. If anything in this video resonated with you, The next step is a private consultation where we can look into your specific situation and give you an honest answer about whether Thuzzle is the right treatment for you. WhatsApp us anytime between 8 a.m. and 10 p.m. every single day. The link is in the description below. And if this was the conversation you needed to hear, follow us on our social media. There's a lot more honest women's health content coming.